Hello everyone, and thank you for the opportunity to introduce our project called Mapping of Glioma Heterogeneity and Infiltration Extent by MR Imaging Biomarkers. My name is Tomas Holecek, and I'm part of the research team based in St. Anne's University Hospital in Brno. Our team consists of 9 members covering neurosurgeons, radiologists, histologists, and people for software engineering and data analysis. The aim of our study is to verify whether segmentation of gliomas based on different MRI biomarkers match each other and if the results can mark regions with high-risk behavior. Moreover, we test the hypothesis that the advanced pattern analysis of multi-parametric MRI is able to provide predictive spatial maps of glioma infiltration and predict the regions of early recurrence. Understanding these imaging biomarkers can focus surgical and radiation treatment to the risk regions and lead to improved treatment efficiency while maintaining neurological function. The identification of highly heterogeneous regions in high-grade tumors will allow more precise targeting of biopsies, surgical resections, as well as more exact planning of adjuvant radiotherapy. One of the improvements of targeted therapy is a decrease of the necessity of multiple stereotactic biopsies. At the beginning of our project, initial imaging protocol, mostly based on literature and experience, was set up and adjusted to the institutional 3 Tesla GE Discovery MR750 MRI machine. We optimized the protocol according to the initial results and, of course, machine options, but there is still need for standardization of the acquisition protocol in order to have results that can be used for comparison among different centers. It's necessary to compare the results that are available so far so that it's possible to cooperate with other centers in the future. We collected around 20 patients till now. COVID situation kind of changed our initial plan, but our goal is still to examine at least 60 glioma patients within duration of the project. We focus mainly on perfusion methods such as DCE, DSC, and ASL, so we can incorporate these quantitative techniques into clinical practice. The first challenge of the processing part of our project is to set the correct way to process the data to get individual MRI biomarkers we can rely on. Perfusion methods like DCE and DSC are not new, but there is still lack of standardization on both acquisition and the processing side. Second challenge is to evaluate significance of individual biomarkers, their combination and matching, so in the final stage, the full version of semi-automatic post-processing software for data processing and calculating can be developed, so in the end, we can get individual biomarkers, maps, their matching, and most importantly, final segmentation representing the heterogeneity of the tissue. The identification of highly heterogeneous region should allow more precise targeting of biopsies. The final map can and will be compared with histological findings. Proliferation activity, cellularity, and vascular density will be measured and correlated with individual biomarkers and their combinations. There is also potential in cultivation of specific tumor sample based on our results and map and testing them for treatment response. All of these methods will serve for evaluating the significance of individual biomarkers, their combination, matching, and of course, accuracy of the segmentation. Thank you for your attention.